It was amazing. I never thought that, I will record so quickly. I'm very grateful to the God first and then to the Dr. Rahul that I landed to the, right place.
So how was the pain before?
Pain was extreme. I was thinking, I cannot even do this. Now
Okay.
I can, do comfortably, I can sit.
Wow. Muscle pain and the vertebral joint related pain, nerve related pain is almost gone.
Yes, I would say more than 90%.
Great, more than 90%. So how is the quality of life now?
Yeah, it's amazing. So I have never seen such kind of treatment, in just one center.
Happy with the treatment?
Yeah, very much happy, and I definitely recommend Dr. Rahul. I don't have words, to appreciate your efforts and the excellent treatment, and the entire staff. They are so friendly. They'll make you feel home. Just come here and see what kind of treatment is given, and see the equipment used, and then you can prepare your mind.
Hi, this is Dr. Rahul Gulve, certified Chiropractor, manual therapist and pain management specialist. So today we are with Mr. Mohammad Afzal, aged about 37 years. He's having low back pain and left sciatica, almost suffering from 2 years. So he used to in Saudi, right?
Yes, I am a resident of Saudi Arabia.
Saudi Arabia. How is your pain?
It's very intense actually. It becomes extreme when I usually sit and I cannot bend like this.
Okay.
It's extreme pain actually.
Okay.
And the pain all goes through the calf.
Okay.
Yes. But more it's lower back pain both sides.
Okay.
Yes.
So any accidental issues, any injuries? So
Yeah, well, the thing which I remember is I used to 6 months before I went for almost 1,000 kilometers drive.
okay.
I did not take any frequent breaks.
Oh.
So I was continuously
Yes,
driving. Yes,
Mm.
yes. And another thing is which I remember is I used to lift. I bend my back and then I lift a heavy gas cylinder.
Oh.
So since then I started to have extreme.
So we have planned 14 visits actually. So this is the first visit and hope he has to go back to Saudi, right?
Yes. I am 28 days left.
28 days left. So we have 14 days only. So hope we can clear his problem. Any manual therapy before?
They used to do some manipulation, 1 or 2 different types. That's it.
Okay.
So, but I went through your video, so you are doing a good job. So
Okay.
that's why I came here all the way.
So after
Yes.
10 sessions, you didn't find any change?
No, maybe slight reduce, maybe 5%.
Okay. So like sideline, manipulate, relax. Fully good. Don't leave this. Hold it here. Hold your hand. Okay. Just down. Oh. Okay, I'll give our flexions. Yes. Don't bend your elbows. Yes, that's it. Up and come back. Good. Do it. This is a pain spot.
Yeah.
Is having pain from L3, L4, L5, S1. Central and left facet joint is more. Walk. Relax. So check out your movement.
Yeah. This side it's not that heavy. Earlier I used to feel some heaviness here,
Okay.
but that heaviness it's gone.
Heaviness is reduced.
Yes.
Okay.
yes,
What
yes.
about intensity of pain?
Yeah, I mean it reduced. I would say this first visit 20 to 30%. I would say.
Great. So in first visit 20 to 30% pain is reduced, but that doesn't mean that the structure got corrected inside. So as we have planned visits, so he's suffering from past 2 years, so the intensity is also very high, and we'll continue the remaining treatment protocols with our international therapeutic approaches, and we'll take a end video. Thank you.
Hi, this is Dr. Rahul Gulve. Today we are with Mr. Mohammed Afzal. So as we planned treatment sessions for his low back pain and left leg sciatica, so this is the last visit. So how is your experience, sir?
Yeah, it was amazing. I never thought that I will recover so quickly.
Okay.
My worry was like I came here on a short vacation, so
Yes.
just 30 days,
Yes.
and I just don't want to waste my time. Just experimenting with my back when I'm moving to one clinic to the another.
Okay.
So that time was very critical.
Okay.
So thankfully, I'm very grateful to the God first, and then to the Dr. Rahul that I landed to the right place.
Thank you.
So almost it's like 90%. It's a recovery. I would say 90%.
Great. So how was the pain before? So you used to stay in Dubai, right?
In Saudi.
Saudi. So you have consulted almost.
I consulted two orthopedic doctors.
Yeah.
Then I consulted the neurosurgeon.
Okay.
Then I consulted the spinal surgeon.
Okay. And along with that.
And I went through almost 1 month of physiotherapy.
Okay.
And then one day I used to feel better. Then the next day the pain used to start. So
Okay.
that was my condition.
Okay.
I was going through like this for almost 6 months.
Okay.
I was going to one clinic to the another, and I used to I did not see any this kind of diverse form of treatments.
Okay.
So just just the one massage and then just the physiotherapy.
Okay.
Yeah.
Any manual therapist? You went chiropractor in Saudi?
Yes, I went to one chiropractor as well,
Okay.
but there also just manipulation were very limited, not
Okay.
like here.
Okay.
And I used to be given a massage,
Okay.
like hand massage, and
Okay.
just 1 or 2 manipulation.
Manipulation.
Then that used to be it used to be repeated every day.
Okay.
So I went through like this for 14 days.
14 days.
Then I felt there is no change.
Oh.
That's how I booked my ticket. Then
To India.
Yes,
So ultimately,
yes.
ultimately, after trying for 6 months, all the
Exactly.
doctors and therapists,
Yes.
so you feel.
I lost my patience basically because it was impacting my professional life. I cannot keep applying leaves, and it's not good. I cannot justify. Yes.
Yes.
Thankfully, yes.
So how was the pain before?
Pain was extreme. So if you see, when we initially visited,
Yeah.
so I was thinking, I cannot even do this. Now
Okay.
I can, do comfortably and sit.
Wow.
So, amazing. Earlier, if you see, I was like, I was having a tough time
Yeah.
doing this, even bending even this degree.
Okay.
Now I can do like this.
The pain was severe. Nerve
Yeah,
pain
very
used to
severe.
inflict.
Yes. Especially when I used to drive and when I used to sit.
Okay.
I used to,
After 2 minutes, you said. After sitting
Yes.
for 2 minutes, the
Exactly.
nerve pain is to
Yeah,
stand.
then immediately I used to stand, take a walk and then come back.
Okay.
But now
Now,
it's all good. I mean, I don't see anything.
how much time you are able to sit now?
Now I can sit. You can ask me to sit 1 hour, I can sit.
Good.
That's
So-
amazing. That's
Okay.
amazing.
So, the muscle pain and the vertebral joint related pain, nerve related pain is almost gone.
Yes, I would say more than 90%.
Great, more than 90%. So, how is the quality of life now?
Yeah, it's amazing.
So, I think you are roaming in Hyderabad fully.
Yeah, because I'm on vacation now. So after many relatives they'll invite me for the
Okay.
functions and all. So
Ah.
I'm all free. Earlier when I visited, when I came here initially,
Hmm.
I used to call my relatives. There was-
You used to call them to.
Yes, for the drive. No, at least for the drive I'm saying to
Ah.
take me. Yes. I was fully dependent on the people.
Okay, you are dependent. You are calling someone to. Take
Yes,
you.
exactly. Yes, or else book the cab. I cannot go myself.
Oh,
So
now
now I can drive all. I don't see.
you are driving in Hyderabad traffic now.
yes.
Okay,
That's a
good.
good thing. Yeah.
Great. Manipulation is the only part of treatment. Along with that, we have given a combination of therapeutic approaches. The treatment was decompression, You can say dry needling.
Yeah, for sure. Yeah. So I have never seen such kind of treatment, in just one center. I went through the needling, I went through shock therapy, I went through the short wave, and then I went through static cupping, I went through dynamic cupping, I went through the decompression. That's the best thing I would say.
Decompression.
All sophisticated machines, know, that's improved my quality of life. That's amazing.
We have given laser, short wave, so it is a combination of therapeutic approaches. So we are treating the source of the problem here, and of course this is a two-way treatment. It is not a one-way. So we are the only facilitators. We are the teachers here to facilitate the structure. What all our exercises has been taught by us. The client has to continue. Hope you are doing that exercise.
Even I would have to say 100%. The pain. Only the 10% is when you taught me the exercises, I was not doing in a appropriate way.
Okay.
Then the next day you told me, you just went through all the exercises, you corrected me.
Yes.
Then from that day onwards, I said, the pain always used to go downwards.
Great.
So
How much time you are taking? It is taking for the exercise.
yes, almost I would say 2 to 2.5 hours if I complete all the sets.
Oh.
I'm taking time. I'm not hurrying. Initially, I was doing I was doing very hurry. But now I'm giving a time to all the exercises. So daily morning I'm doing one time and evening I'm doing one time.
If we are doing exercises, so definitely we are seeing the changes in the structure. We are strengthening the structure, and the capability of the structure used to improve. Then automatically pain comes down. But definitely the exercises are customized, and depending upon the severity of problem, depending of the area of the problem, and depending upon the what area, what structure involved to cause the pain to the patient, it is vary from patient to patient. So we always customize the exercises depending upon the need of the client, and we will give filterized exercises so that the structure has to improve its range of movement. Structure is to get accommodate inside, and structure is to get strength. So as we are seeing tremendous improvements in majority of the cases. So people who are suffering with this kind of low back pain and sciatica, tried everything. So please choose as a last option. Please come to us and take a significant change. And in majority of the cases, we are seeing significant changes. So we'll manipulate his spine first. Relax. Good. Yes. Mobilize it. Alright. Walk. Can I see your flexibility now?
Yeah.
The forward bending,
The forward unit.
maximum pitch.
Yes.
With no bend.
No. Thanks a lot.
Happy with the treatment?
Yeah, very much happy, and I definitely recommend Dr. Rahul because in my case, doctor recommended me to go with the steroid injections, and then finally said even the injection doesn't work, then you have to go with the complex surgery because the L4, L5, and that's one days it's very complicated. So I was undergoing depression. So
From 6 months you are you have tried everything.
Yes. Almost many very big, so many hospitals. I did not leave any hospitals for the treatment. But I don't have words to appreciate your efforts and the excellent treatment. And the entire staff, they are so friendly. They'll make you feel home. So that's the form of treatment is given here. Definitely, if you have such severe pain, just come here and see what kind of treatment is given and see the equipment used, and then you can prepare your mind.
Thank you.